Good morning, everybody, and welcome to Comfortel's Diamond Microdermabrasion webinar this morning. Thank you for joining us, and I hope that you all get a lot out of today. Before we start, I just want to go through a couple of things for those of you who may not have ever joined on a webinar before. So it's a little bit different to a meeting. So before we actually start to get into our content this morning that we're going to cover, I just want to talk to everybody a little bit about how the webinar is going to work and when you'll be able to have your chance to ask some questions, because I'm fairly sure that some of you will be busting to ask some questions. I just want to let you know that we will have a time for questions and answers at the end of the webinar. So what you can do, you won't be able to ask any questions and be heard, but you'll be able to type some questions into the chat box. So you should see a little chat box on your screen, and you can just type in your questions into that chat box, and then they'll appear on my screen. And then I will take some time towards the end of our presentation this morning, and I'll go through all of those questions and answers with you. Hopefully we can get to everybody's. So we will have some time for that, definitely. While we're going through the webinar this morning and I'm taking you through the slides and the videos and things that we've got for you to watch, feel free to type your questions in earlier than the question and answer time. So if something pops into your head and you go, oh yeah, I really want to know this or that or whatever, type that into the questions now by all means. But just please be aware that I'll make the time to address all of those questions, and I'll give you the answers at the end. So I won't give the answers as we're going through, but as I say, I'll allow some time for that at the end. So feel free to pop some questions in there, no problem. So as I was saying, I just wanted to welcome everybody. Thank you for taking the time out of your day. I know for some of you guys in the Western States, it's early for you guys. And for anybody in New Zealand, I know it's a little bit getting towards lunchtime perhaps for you guys. So thank you very much for taking the time to join us. We expect we'll have the webinar running for about 50-55 minutes, maybe up to an hour, depending on how many questions people have got as we go along. So welcome to join us for that time. And as I say, I hope that you all get something really interesting out of the video and the discussions that we're going to have this morning. Okay, so what we're going to be looking at this morning is our microdermabrasion treatment. So we're going to be showing you through our microdermabrasion system. So you may already have a microdermabrasion system in your salon or your clinic. This is our Comfortel microdermabrasion machine that you can see on the screen there now. So yours may look a little bit different, but most of them, they all kind of work fairly much the same way. There might be small variations in terms of what tips you may have or the way that your machine works. So we'll be talking a little bit about our machine, but as I say, the treatment principles are fairly general, regardless of which machine you might be using. This is me, obviously. So my name's Mishelle Pemba. I'm Comfortel's national trainer. I've been working here at Comfortel for about 14 years now. So my role here is to help all of our customers to use the equipment that they buy from us. So anything that you buy from us, you can get some backup support, you can get some technical advice, you can get some training for a lot of the equipment, and in a lot of cases, it's me that will do that for you and help you out with those things. So we actually have a series of videos on our website. Towards the end of our presentation today, I'll talk to you a little bit about where you can get some of that information and watch the videos. We have always run some training at our head office, which is in Melbourne, which is where I'm based. For the past couple of years, we've been running some training sessions. We normally do them face-to-face, but of course at the moment that's not happening anywhere. So we've decided to take all of our training online as these webinars. We're going to have a series of these webinars. We'll have some more coming out over the following weeks. So definitely keep an eye out on our website, and you may get some mail from us telling you what's coming up available. So keep your eye out for those, and certainly feel free to join any of those that catch your interest. There's no cost to the webinars. We're doing that as a free service. Particularly, we know that a lot of our salons and clinics are having a really difficult time at the moment. And, you know, things are a little bit tight for a lot of salon owners and staff with, you know, no employment at the minute. Although for some of you guys interstate, that's about to change. So lucky you, we're still in lockdown here for a little while longer. So we just wanted to offer everybody the opportunity to get some education, maybe learn something that you haven't done before, maybe get a refresher, maybe, you know, help you out with some new techniques or something like that that may be a little bit different to what you're used to. Any of those things, whatever you can get out of today, then obviously welcome to that. So let's first of all talk about what microdermabrasion is exactly. So microdermabrasion is a treatment that uses a vacuum suction and an abrasive tip of some kind. So this particular webinar, we're talking about the Diamond Microdermabrasion. So as you can see in the picture, there's a little screw-on stainless steel tip that screws onto the handpiece of your machine. It's diamond crusted, and as we draw that over the skin, the vacuum suction sucks the skin up against the tip, and then we get that abrading of the epidermis. So it actually works mostly on just the outer layers of the skin, so the stratum corneum, removes some of that loose, dead, dry skin, so it gives us a fresher skin. It's kind of, I say it's like vacuuming the skin, the way that you would vacuum your carpet or your floor to get off all of the little bits of whatever's stuck there. We do the same thing to the skin. So we're actually giving the skin like a turbocharged exfoliation, vacuuming off all of that dead skin, as well as anything that might block up the surface of the pores, like a bit of excess oil, a bit of makeup that maybe you haven't cleansed off enough, any of those things that build up and make the skin look dry, make it look dull, devitalized, and certainly contribute to things like breakouts, comedones, and those kinds of things. So that's basically what our microdermabrasion treatment is. And that's something that you may like to explain all of that to your clients. Sometimes people book in for things without actually really knowing what the treatment is. So it's kind of helpful to explain to them exactly what the treatment is and what it does and how it works. I think your customers actually really appreciate that little bit of extra knowledge and information. So let's have a look at the indications for treatment. So when we say the indications for treatments, it basically means the conditions that the client may have on their skin that makes them suitable for microdermabrasion treatment. And we'll talk about the benefits, so what they can actually expect to achieve from having a microderm. So you can see on the screen there all of the indications for treatment. So anybody who's got rough, dull, flaky or devitalized skin, congested or breakout prone skin, skin with milia or comedones, so blackheads, whiteheads, those kinds of things, it really, really helps to reduce the amount of that kind of stuff that you get in the skin, and it makes it much easier for you to do any extracting. So if you've got a skin that is really congested or that's got lots of comedones, before you even try to do any manual extracting, I very often do a couple of microdermabrasion treatments a couple of weeks apart, just to reduce that thickened corneum layer so that you can actually get those blockages out a little bit more easily. It causes less trauma to the skin, it's easier, and it actually just makes it a better process for the client. They're less prone to having, you know, little scabs and things like that after the extractions, because you don't have to open the skin up as much to get them out. It's a really effective way to do it. Also, for anybody who's aging or has sun-damaged skin, microdermabrasion works really, really well to refine the skin and improve the appearance of superficial pigmentation. Certainly, skins with excess oil as well will really, really benefit from this. So we can vacuum off all of that blocked up oil and the dead skin that causes all of the blockages that can then contribute to the formation of acne and things like that. Also, for acne scarring, where we've got surface irregularities in the skin, microdermabrasion is fantastic just to refine the surface a little bit and improve the appearance of the skin. Now you can see listed on the screen there some some frequency recommendations for your clients. So if you've got a client who's interested in microdermabrasion, most of the time they'll get the best results from having a series of treatments. So we may recommend a series of up to 6 or 8 treatments depending on the skin, and you can see the frequency listed there. So about once a month for most skin conditions. And if you've got clients that have got acne or they've got things like acne scarring, I recommend that they come in a little bit more frequently. I like to get them in every 2 weeks if they can, particularly with acne. Otherwise, the skin just kind of keeps building up as you're trying to vacuum off all of that debris. It's just building up all the time. So I normally do get them in fortnightly if they've got acne. So you can give them like a little bit more intensive course of treatment, and that works really, really well. So these are the benefits that our clients can expect to receive after some microdermabrasion treatments. And actually, they will even see an improvement straight away. Like even after the first treatment, they'll feel that their skin is much smoother. It looks much more clear. The colour of the skin is improved. And particularly if you've got one of those skins or your client's got a skin that's a little bit sallow, where the circulation's not really good in the skin, the microdermabrasion and the vacuum suction actually helps to draw blood up into the skin. So it gives you that beautiful kind of rosy colour to the skin. So really beneficial for all of those things. Also, as I mentioned, it removes and exfoliates the dead skin cells. So it's like a super turbocharged exfoliation for the skin. As I've already mentioned, treating acne scars and surface pigmentation particularly. So, you know, when you've got clients that they've had problems with their skin, or maybe they've had a little pimple and they've squeezed it or something like that, and it leaves you with a little mark on the skin. That's the kind of superficial pigmentation that is removed really, really well with microdermabrasion. So if you've got some of that marking on the skin, a couple of microderm sessions helps to lift that, and you'll just get a much clearer complexion afterwards. And as I already mentioned, removing impurities and congestion in the skin, really beneficial for those mild acne cases. I wouldn't be recommending this on a very pustular acne or an inflammatory acne, but on your milder acne conditions where you've got a lot of congestion and a lot of comedones, really, really helpful for those kinds of skins. So let's talk client preparations. A few things that we need to do before we actually start our microdermabrasion treatment. We need to give the skin a really good cleanse, and we need to do a skin analysis. So your skin analysis is really, really important. So that actually helps you to determine the parameters that you're going to use and what kind of a treatment you're actually going to do for your client. So let's have a little look at our video. I'm sure you all know how to cleanse somebody's skin, but anyway, here you go. So I like to use an eye makeup remover first. So remove the makeup that they may have on their eyes, and also I remove any lipstick or lip gloss or anything that they may have on their lips as well. So our model there didn't have anything on her lips, but just give them a really good go with the makeup remover first, and then a foaming or a gel cleanser I prefer rather than a cream. So you can see me there in the video using a foaming cleanser. I just find the foaming cleansers work really well because they tend to remove those surface oils off the skin a little bit better than a milky or a creamy cleanser. Certainly you can use a milk or a cream if you want to. There's no problem with that. You can use your toner after you've done the cleanser if you're using a cream cleanser. But if you use a foaming cleanser or a gel one, as you can see me using in the video there, I don't usually use the toner afterwards. I find that you don't need that. You get a really nice squeaky clean skin after that foaming cleanser. So if your client's got makeup on, you need to give them a double cleanse. So you'll do 2 lots of cleansing just to remove all of that makeup off the skin first. Once you finish your cleansing, it's really important to analyse the skin. So you want to have a look at how thick or how thin the skin is. That will determine your vacuum settings. You also want to sort of work out what kind of a diamond tip you're going to use. We're going to talk about that in a minute. And so your skin analysis will help to give you all the information that you need to determine what kind of a treatment, all of that kind of thing that you need to know. Have a look and see how sensitive the skin might be. Have a look and see if the skin is very vascular or if it's red. If you've got a vascular kind of skin, you need to use a much lower setting of your vacuum. You may have an extremely sensitive skin, in which case maybe I wouldn't really recommend the microderm as being a suitable treatment, but certainly if you've got a thinner or a more lax or a loose or a sensitive skin, or a skin that maybe has got some, fragile capillaries on the cheeks, you want to use a less abrasive tip, and you want to use a lower setting of vacuum as well. So your skin analysis is going to give you the information that you need to determine what parameters you're going to select for your treatment. let's have a look at the diamond tips that are available. Now, this is with our machine. So as I said earlier, if you've got another brand of machine, you may well have some slightly different tips. These are the tips that you can see on the screen now that actually come with our Comfortel Diamond Microdermabrasion system. So what you can see, there are 10 tips in total. There are 5 small ones, and the small tips are designed to use on the smaller curved areas of the face. So the nose, around the brows, around the lips, the chin, so those small kind of curved areas of the face, and then the large tips which are designed for the larger and more kind of flat areas of the face. So the forehead, the cheeks, the sides of the face, the neck as well. Now, what you can also see is that all of the tips are numbered, and in the pictures you can actually see on the side of the tips that there's some numbers on them, and then just mentioning to you that that's the grit as we refer to it. So the level of abrasiveness of the tip is what you're looking at with those numbers. So with our machine, you have the small and the large, as I said, and you have tip numbered 75, which is the most coarse. Then you have 100, 150, which is like the middle or the medium tip, 200, and then 250. So the 250 textured tip is the finest or the least abrasive. So as I was saying, you're going to use the information that you've gathered from your skin analysis to help you to decide which one of those tips you're going to select. So if you've got a skin that's much more coarse and a thicker skin, you might choose a 75 or a 100 in your tip number. If you've got a skin that's quite fine, or a skin that's a little bit thin, or a more mature skin, you might go for a 200 or a 250. So you can make those decisions based on the qualities of the skin as you've determined from your skin analysis. So as I was saying, you're going to choose the parameters of your treatment, so the level of abrasiveness of your tip, or the grit as we call it, but also the level of vacuum suction according to the skin condition. So as I've mentioned on the screen there, you can see some text that's just saying to you, you can actually use a couple of different tips, and I very often use about 3 tips, sometimes even 4, in a treatment for one client. So if I've got, for example, a normal skin type, it's not thick, it's not thin, it's not mature, it's not sensitive, it's just a normal skin, I might do the first pass with the tip numbered 150, which is like your middle or your medium grit tip, and then I might do a second pass with the 250 tip, just to give what I call a buff and polish, just to smooth the surface of the skin. If I've got acne scarring, or I've got a thicker or a much more coarse skin, I might do my first pass with the tip that's numbered 100, which is on the more abrasive side, and then I might do my second pass with the tip that's numbered 75, which is the strongest or the most abrasive tip. I really want to get into those areas of acne scarring. I want to really smooth the skin as much as I can and make a much more intensive treatment. So that's just giving you some ideas about how you can use different tips for the first pass and the second pass, and you'll use your clinical judgment there to decide based on the qualities of the client's skin. Now, mentioning on the screen as well the level of vacuum suction. Now, with our machine, and again, our machine may be different to yours, we've got 8 levels of vacuum. So when you turn the machine on, it's got like a little bar on the front that as you increase the intensity, you can see like the little coloured bar slide up to 8 bars, which is the maximum level of the vacuum strength. Now, for most clients, I will use anywhere from level 2 to level 4, perhaps. Level 2 to 3 is suitable for most skins. You might use level 4 if you want to do a really, really intensive treatment. But if you need to, you can, as I said, go up to level 8, no problem with that. So you will make all of those selections based on the customer's skin characteristics. Now, let's have a look at the actual treatment. So you will develop your own technique. You don't have to start on the forehead. You can start on the forehead or you can start on the chin. Either is okay. What you do want to do is just make sure that you're following a routine and make sure that you know where you've started, where you've done, where you haven't done yet, so that you don't kind of miss any areas and so that you don't over-treat any areas. So what you can see me doing on the screen there, see me supporting the skin with the fingers of my left hand and also my little finger on my right hand. I'm actually using those fingers to support the skin. So it's really important that you support the skin while you're doing those vacuuming movements. So you can see me using those sweeping kind of movements. I call it vacuuming because that's literally what it's like. And just using the fingers of your other hand to support the skin so that you're not pulling or stretching the skin, and just covering all of the areas of the face in those small sections. So see me using my thumb of my left hand and my right hand little finger just to hold the skin. You can use your thumb and your forefinger of your non-working hand, and you can work in between that. When we were doing the videos, if I was doing that, it gets in your way a little bit and you can't see very clearly what I'm doing. So I'm using my thumb of my left hand and my little finger of my right hand to hold and support the skin. It doesn't really matter whether you do it that way or you use your thumb and your forefinger of the left hand, as long as you're supporting the skin. That's the most important thing. So now cover all of the areas of the face where you can. Work from the central areas of the face to the outer areas of the face, because that actually gives us some lymphatic drainage as well, which is beneficial for most clients. So cover all of those areas of the face as best you can. This is your first pass, and then you will actually see me doing the neck as well. Now, you can include the neck, but as I mentioned earlier, the vacuum setting needs to go down for skin that is more loose or more sensitive, and definitely we would include the neck area as being that kind of skin. So it's not firmly anchored over bone the way that your facial skin is, so adjust your vacuum setting right down. So if you've been using level 3 or level 4, adjust it right down to level 1 or level 2 to do the neck. Now, you can see me just quickly finishing off the left-hand side there. So basically, that's the end of one pass. You're going to do 2 passes in total, but we'll talk more about that as we go. Now, that was with the large tip, I should have pointed out, sorry. So now what we're going to do, we're going to use the small tip. And as I mentioned earlier, the small tip is for the smaller and more curved areas of the face. So basically the central panel of the face. If you're using the large tip, you'll find sometimes that the suction won't kind of hold onto the skin as well, and you'll lose the suction and then the tip will kind of slide off the skin. So when you're using the small tip, it's got a really, really small suction area, and it will give you a really, really good contact on all of those small and curved areas. So you can see me really clearly there, just moving backwards and forwards over those areas of the face. So giving it a really intensive treatment. Again, think of it just like vacuuming the skin. You're literally vacuuming all of that dead skin and blocked up oil off the skin. And again, you can see me using the fingers of my other hand to hold the skin firm so that the skin's not being pulled and sucked by the suction. Really important when you're working, particularly around the mouth area, around the eye area. Don't go into the eye contour area, but you can work to the lower borders of the eye. Basically where the skin's supported by bone is where we want to work. Don't work on the areas inside that are not supported by the bone underneath. So there you can see me actually just vacuuming all of those smaller areas around the brow, the central panel of the face, around the nose, the lips, the chin, and any areas where you want to give it a more intensive treatment. So you can actually really concentrate on areas of, say, acne scarring or congestion with that small tip, and it gives you a really concentrated effect. And then, as I said before, just going to finish off the same on the other side of the face. Now, as I mentioned before, you can do 2 passes, and I really do recommend 2 passes. So basically, you will do a second pass of exactly the same. You may use a different tip. What you'll often find is after the first pass, your tip that you used for that first pass will be full of skin debris. So I very often swap and put on a different tip for that second pass. And as I mentioned before, you can make it a finer tip to give what I was calling a buff and polish, or you can use a stronger tip to give the skin a more intensive treatment. So certainly you can choose a different number to vary the intensity of the treatment when you do that second pass. Okay. Now, after you have finished doing your microdermabrasion treatment, I like to use a hot towel just to get all of the skin debris off. What you'll find, and if you've ever had a microdermabrasion yourself or if you've ever done one, you'll see, particularly after the Diamond treatment, because it's a dry treatment, you'll see that there's lots of what looks like dust or powder on the skin, lots of residue, and basically it's the powdered skin cells that we've vacuumed and loosened, and you'll see some of that debris kind of sitting on the skin surface. Before we do any other treatment, we want to get that off. So I prefer to use the hot towel. I don't like to steam after a microdermabrasion because we don't really want to put that much heat onto the skin. So the hot towel is perfect, and you can do that just really nice and quickly. Pop the hot towel on and then just wipe the skin the same way that you would remove a mask or a cleanser with your hot towel, and that actually works really, really well to take all of that debris off the skin and prepare the skin for any further treatment, like some extraction, for example. So if you do need to do extracting, at this point in time, that's the perfect time to do it. You've removed all of that excess dead, dry skin, so the comedones are much easier to get out. You've given the skin a little bit of a gentle steam with the hot towel, so again, everything's kind of soft and ready to extract the same way that we would normally use our steamer in a facial before we did any extracting. So if you need to do manual extractions, this is a perfect time to do it. And as I mentioned, I prefer the hot towel to the steamer because we just don't want to put too much heat on the skin after the microderm. That's quite important. Now, if you want to, you can actually go on and do lots of other steps of your facial, but what I consider almost essential really after the microdermabrasion is a mask. So if we just finish our microdermabrasion and put our treatment creams on and then that's it, the client goes home, it's quite common to experience some slightly adverse effects after a microdermabrasion, and most of them are related to the fact that we've actually vacuumed off some of that barrier function of the skin. So when we've vacuumed off that dead cell layer, it actually reduces the skin's protective mechanisms. So for sort of 24 to 48 hours afterwards, it's quite common for people to have a little bit of sensitivity. People can have a little bit of dehydration, certainly some flakiness, and sometimes products that they may put on their skin, like even their normal moisturizer and things like that that they would normally use, those things can sting, and that's related to the loss of barrier function. So when we've done a microdermabrasion treatment and we've disturbed that barrier function, it's actually really important that we restore the skin by putting something back into it. So in my opinion, it's vital to do a mask, and I automatically include that in my microdermabrasion treatment. Some salons may charge extra for that. That's up to you, but I think it's really, really important to do. So the purposes of doing our mask, as you can see on the screen there, number one, to soothe the skin so that we don't get that sensitivity afterwards, to hydrate the skin, which is of course really important so that we can avoid dehydration issues, restore that barrier function, and reducing flaking and sensitivity. So the mask actually helps us with all of those things after the treatment. So you can go through all of the masks that you've got available in your salon, and I'm sure that you've probably got quite a lot. I like to use a cream or a gel or something like that. You can use like a collagen mask. You can use those tissue masks. There's a lot of those tissue style masks around in industry at the moment. So anything that you've got, but ideally something hydrating and preferably something soothing if you've got it. So look for any of those kind of qualities or properties in your mask. Something that I will mention to you, after we've done the microdermabrasion, as I said, we do get a loss of that barrier function of the skin temporarily. So sometimes some masks that you might normally use, they can sting after a microdermabrasion. So my advice would be give yourself a microdermabrasion because you need it as well, and try the masks that you've got, and you may well find that one or two of them sting a little bit, and you'll probably find that you've got one or two that don't sting, that are quite comfortable after the microdermabrasion, and they would be my choice of what to use. So just do be aware that it's reasonably common that a mask can sting. When you're putting your mask on, let your clients know that as well, and just say to them, oh, let me know if it feels a little bit tingly or a little bit stingy. That's fairly common. Explain to them why, because we've disturbed the barrier function of the skin. And what you will normally find is if the mask stings a little bit when you first put it on, it generally subsides after a minute or two. So just let your client know that that's kind of pretty normal. Okay, and as I say, try to choose the ones that are the least stingy out of your range of what's available. We would normally leave the mask on for 10 minutes as well. So let's have a look at popping our mask on. Again, I'm sure you all know how to do this. So just popping a little bit of that on. Of course, you can put it on with your fingers as well. If you're going to put the mask on with your fingers, I'd recommend that you've got some gloves on still. Because I'm using my brush, then I'm not having any gloves at this point in time. I probably should have mentioned while you were watching the microdermabrasion video, I did actually have gloves on while I was doing the microderm, and that's really important. The health regulations do state that you should wear gloves while you're doing the microdermabrasion. So pop your mask on, leave it on for 10 minutes or so, and then take it off with your sponges or your fibrella or your hot towel or whatever you would normally use for taking your mask off. And after that, the skin will be much more comfortable, and we shouldn't have those issues of sensitivity and dehydration and flaking and that kind of thing. But certainly you can have some of those adverse events if you don't do your mask and if you don't restore the treatment, the skin after the microderm treatment. All right, let's have a look at some finishing products. So after you've finished your microdermabrasion, you've done your mask, you're going to put on some moisturizer to rehydrate the skin and protect the skin, and really importantly, some sunscreen as well. Let's have a look at popping some finishing product on. So again, be aware that some products, if they've got a lot of active ingredients in them, like fruit acids and things like that, they can sting a little bit after the microdermabrasion. So we recommend something that is soothing and hydrating and without too many actives like your AHAs and things like that. Give those a rest for about 24 to 48 hours. Sunscreen, as I said, really, really important. You need to make sure that you pop some sunscreen on before your client leaves the salon, and recommend it for them to use every day as home care as well. It's really important when they've had a microdermabrasion treatment, and particularly when they're having a course of microderms, that we protect the skin from UV damage. If we don't, because we've temporarily thinned the surface of the skin, it can actually make the skin a little bit more vulnerable to sun damage if we don't protect it. So vitally important that we do it for the client before they leave, and also educate them about the importance of protecting their skin from the sun. As it mentions there in the notes that you can see on the screen, I prefer a physical sunblock if you've got one in your range. Sometimes the sunscreens that work on a chemical blocking basis, they can sometimes cause a little bit of sensitivity. They may be a little bit stingy afterwards. So if you've got a physical blocking sunscreen, then they tend to be the more comfortable ones to use, particularly immediately after the microderm. So pop some sunscreen on and make sure that your client's doing that at home as well. Now, just a little mention about adding other treatments in. So certainly you can do the microdermabrasion as a standalone treatment. The actual microdermabrasion just on its own takes about 30 minutes to do. By the time you do your cleanse, you do your skin analysis, you do your microdermabrasion, as you've seen in the videos, that's about a 30-minute treatment. If you add a mask on, that will take 40 to 45 minutes. But if you want to include other treatments, then of course you can do that. And a lot of salons do include microdermabrasion in a package of other treatments. And there's lots and lots of other things that work really, really well with microdermabrasion. So you can see some suggestions listed up there on the screen for you. So you can actually just continue on with the steps of any of your regular facials. Certainly you can do a massage, you can do infusion of your serums, and obviously after we've removed all of that dead skin barrier, all of our serums and things like that are going to penetrate and be much more effective in our treatment. So definitely if you want to infuse your serums, you can use things like ultrasonic. You can use galvanic galvanic, but just make sure that you don't put your settings too high. We don't want to run too much current on the skin after we've taken off some of that dead cell protective layer. So just make sure if you're using something like galvanic that you're just checking with your client to make sure that they're comfortable and not finding it too strong. Okay, so be mindful of that. Microdermabrasion works really, really well with oxygen treatments afterwards, and in the still shot that you can see on the screen there, that's the oxygen infusion gun of our Oasis oxygen facial system. So you can actually use some oxygen, spray the oxygen, and usually a skincare serum goes with that as well. That works beautifully after a microdermabrasion, and it cools and soothes the skin really nicely as well. You can also use LED as well. LED works brilliantly with microdermabrasion. Now, the popular thought these days is that we actually use the LED before the microdermabrasion rather than after. So the thought on that is when we use the LED, and particularly the red light LED, the red light wavelengths actually stimulate your skin's healing mechanism. So it actually increases your skin cell activity, and actually it helps us to get optimum healing from our treatments afterwards. So if you do the LED first, think of it as preparing the skin and getting the skin ready to heal and restore itself after the microdermabrasion. And it actually optimizes the skin cell functioning so that your treatment actually works better and much more effectively. So lots of people do the LED afterwards as well. I know there's lots of salons that do that, but it's interesting to note that a lot of people are now starting to use the LED treatments before. As I say, think of it like prepping the skin. Think of it like, you know, you wouldn't just go out and run a marathon with no training and no preparation. You're going to do a little bit of training first. So think of the LED as kind of the training for your skin before you do those intensive treatments. Now, skin needling, some people do combine skin needling with microdermabrasion as well. And if you're going to do that, we would recommend that you do your microdermabrasion first and then your skin needling after that. And the way that that works is that the microdermabrasion will have removed that excess dead cell barrier. So you actually get a better clinical endpoint faster with your skin needling. So you may find with your needling that you may not have to use as much depth of your needles. So you'll actually get that pinpoint bleeding that we want to see with the skin needling. We will actually see that a little bit faster and at a lesser depth, which is actually beneficial for everybody. So certainly you can combine those sorts of treatments. Now, very often people ask me, what about peels? Now, the truth is that you can use some peels after microdermabrasion, but you need to be really careful. You need to make sure that you really know what you're doing with your peels, and you need to know what chemicals are in your peels. You need to know the percentage of those chemicals in the peels, and you need to know what the pH of those peels are as well. The lower the pH, or the more acidic that peel is, the more it will actually penetrate through the skin. And so as it kind of makes sense to think about it, if you've reduced some of that dead cell layer, those peels are going to go in much, much faster. So please do be very, very careful with that. And please make sure that you check with whoever you purchase your peels through. So your company that you get your peels from, make sure that you get some training from them and make sure that you follow their recommendations in terms of whether you could or should use the peels with microdermabrasion. And if so, make sure that you're checking which peels you can use, how long you should leave them on for, and that kind of thing. So just be aware that there is potential for those peels to act much faster than what you think they might, and that's not always a good thing. So be a little bit mindful of that. Now, treatment pricing. This is something that people ask me about all the time. And the truth is, there's no one answer to this. It depends on lots and lots of different variables. So some of the variables that you want to take into consideration when you're looking at your pricing, I've mentioned those on the screen there. So let's just go through those. What you want to consider, first of all, you want to consider whether you're doing the microdermabrasion as a standalone treatment, so just by itself, or whether you're going to include other treatments with it. So that actually means that you've got to take into account how much time either you or your staff are going to spend doing this treatment. So you need to obviously pay your staff for the time. And so if you're going to use half an hour, or if you're going to use 45 minutes, or if you're going to include other treatments and it's going to take, say, an hour and a quarter, you need to take that into consideration with your pricing. Okay, I've put some suggestions there. Now, this may or may not work for you in your salon's costing, and obviously that's something that we recommend everybody should take all of that into consideration using their own circumstances. But I've just put some suggestions there. What I see a lot of people charging out in industry, just a 30-minute microdermabrasion alone with nothing else added in, you might charge anywhere between $65 and $75 for that. If you're going to add the mask, that will take an extra 10 or 15 minutes. Plus, there's your product cost going in there as well. So you might be charging $75 to $85 for that. So it's probably about another $10. You may make it a little bit more depending on what kind of a mask you might use and the cost of that mask for you. Now, if you're including it in a facial, that will probably take you about an hour and a quarter to do the whole facial with the microdermabrasion in it. And you might be charging anywhere from $95 through to $150, depending on what other steps you're going to include with it, and also including what product you might use with that. And, you know, if you're just going to squeeze some mask out of a tube, that tends to be reasonably cost effective for you. But if you're going to use a tissue mask, for example, then they tend to come at a much higher cost. So you've got to take all of that into consideration when you're working out your treatment pricing. As I've mentioned, think about the cost of your product overall. Most of your companies should be able to provide you with costing of, what it will cost you to use the product to do a facial. So take into account your cleanser, your toner, no exfoliation, because of course the microdermabrasion is your exfoliation. If you're going to use your massage cream, if you're going to use your mask in a tube, or if you're going to use your sheet mask, take into account all of the costs of all of that product, plus your staff operator time, plus things like your cleaning chemicals, your consumables. We'll talk about those in a minute. There's not very much consumable associated with the Diamond Microderm. I'll talk you through that in a few minutes. But you want to consider all of that, as well as the costs of just running your salon. So the rent, the electricity, those other little things like a few tissues here and there and whatever. You may also take into consideration the cost of your rent, depending on whether you're in a shopping centre or you might be in a strip shop, out in a suburb, or if you're in a regional area, how much competition you've got, what you pay your staff per hour. And as I said, that is relevant based on whether they're going to take half an hour to do the treatment or they're going to take 45 minutes. So those are some of the things that you want to kind of consider in putting together your treatment pricing. So for some of you, you may find that pricing that I've suggested there is kind of relevant and helpful. Some of you might feel like it's not appropriate for your business. That's okay. And I'm assuming that, you can do all of those sums and add up all of those expenses that it's going to cost you to provide the treatment and work out your costing from there. But there's just some suggestions for you to work with. Now, let's talk about cleaning. Cleaning is really, really important, and particularly it's important with the Diamond Microderm tips because you are obviously going to use those again. You are not throwing out your Diamond Microdermabrasion tips. So cleaning is really, really important. Now, after every single treatment, you need to go through the thorough cleaning protocol, which we're going to show you in a minute. So I just want to talk you through it a little bit first, and then we're going to show you the video of how to clean your tips properly. So it's really important to avoid cross-infection. So aside from coronavirus, COVID-19, all of those things that we're doubly concerned about now, we also want to be really concerned about whether or not we might be passing some body fluid exposure. Say somebody's got a little blemish and you go over it and you might get a little bit of blood or a little bit of pus or something like that. There is definitely potential for body fluid exposure with the microdermabrasion. So we definitely need to make sure that we are not ever going to pass on any of those potential infections to another client. So certainly if anybody's got a cold sore, you are not going anywhere near them with the microdermabrasion. But just on the off chance that there was any bacteria or any infection of any kind on the skin, if you're aware of it, you're not going to do a microdermabrasion, but just to reduce any risk of passing anything to anybody else, including yourself, we need to make sure that we're cleaning the tips correctly. Now, the third dot point there, it's really important that you make sure that you're aware of what your state health regulation guidelines are. And that actually does vary from state to state. Because we're a national company and we've got all of our showrooms in all of the different states, we recommend that you get in touch with your local council, and you should actually read the health regulation guidelines for your state, because the recommendations for lots of things, including how to clean the microdermabrasion tips, it actually does vary from one state to another. So make sure that you're aware of that. Here in Victoria, the recommendation is that any microdermabrasion tip or any item that you're going to use for a skin penetration procedure, and they do consider microdermabrasion to be a skin penetration procedure, the item that you are using, in this case the tip, must be sterile at the point in time where you commence that treatment. So that's just some of the regulations that are relevant to microdermabrasion here. And as I said, just make sure that you check with your own state regulations and check with your local council to make sure that you're actually compliant with all of those. It may also be a condition of your insurance company agreeing to cover you to make sure that you're providing the correct protocols for treatment and cleaning and things like that. So make sure that you do have a good look at those regulations. Now, let's have a look at the cleaning and maintenance steps. This is really important. So first of all, you need to use a toothbrush or a small brush. I use a toothbrush. I find it works really well with a little bit of detergent or soap, and you need to scrub the tips under running water using that toothbrush and the soap, and that actually gets out all of the little bits of the dead skin particles, the skinny bits as I call them. After you've scrubbed, give them a really good rinse again under running water, so all of that skin debris is kind of being washed out of the tips. After you have cleaned them, you need to pop them in a sterilising solution. Now, in Victoria, we're permitted to use a chemical sterilising solution. I know in New South Wales, they don't permit you to do this. They actually say that your tips need to be autoclaved. So that's just an example of where there's a difference from state to state. So please make sure that you're aware of that, and please make sure that you're following the correct recommendations. Now, as it was showing you in the video, after the correct amount of soaking time, and that will vary depending on what chemicals you're using. If you're using something like isopropyl alcohol, they recommend a 20 to 30 minute soaking time. I usually give them 30 minutes just to be sure. There are also other chemicals like glutaraldehyde and Adol and things like that that you can use. Just to be very, very clear that you must never use bleach or any bleach containing compounds on the tips, because they're metal. The bleach will actually corrode them and it will damage your tips. So please make sure that you're using a solution that is appropriate to be used on metal. Here in Victoria, they recommend isopropyl alcohol or bleach, but as I said, no bleach on the tips. So definitely isopropyl alcohol is what I would recommend here in Victoria. Again, for the different states, follow your recommendations. Whatever chemical you're using, you need to make sure that you read the instructions and follow them correctly for the dilution requirements. So how much of the chemical you need to use, if you need to mix it with water or if you use it straight, and the recommended soaking time. And again, that will vary from one chemical to another. So please make sure that you follow those regulations. After the correct amount of soaking time, I actually like to give the tips a really quick rinse with some hot water just to make sure there's no chemical residue on them, and then you need to leave them out to air dry. So it's important for you to know that those tips are actually not sterile until they are dry. So please make sure that you don't put them away or you don't use them again until they are dry. Once they're dry, we recommend that they get put in a clean covered container. So if you're using our machine, they actually the tips come in a little box. You can put them back in the box. If you don't have a box, then you can use anything, like even if it's a little Tupperware container, just as long as those tips are put away in a covered container to prevent them from, being contaminated before you use them again on your next client. So really, really important to make sure that you do that. Now, let's have a look at the Comfortel microdermabrasion system. So some of you that are watching, you may already have our system. Some of you may have a different system, and as I said, you'll find some small variations from one system to another, maybe in terms of how the vacuum settings work or what tips you get, for example, that kind of thing. So with our machine, you can see a picture of it there on the screen. That's exactly how it looks. There's a little Perspex holder on the side that it actually holds onto your handpiece, which is really handy. And you can see the 10 tips that you get. As I said, 5 small ones and 5 large ones in those varying grits. So 75 is the strongest grit, all the way up to 250. So there's 5 different variables of grits and the 2 different sizes. Now, you actually get 3 of the hand pieces with our machine. So in the picture, you can see the handpiece sitting in the little holder on the side of the machine. You can wash out that handpiece as well. So that actually comes off the hose, and you get a little box with 3 of those handpieces in total with our system. Okay, now when you start off, you will get a little bag of 5 or 6 filters. Now, we haven't talked about the filters yet, but it's important to note with our machine, and again, others may be different, there is a little internal filter that actually sits inside the area where the handpiece hose connects onto the side of the machine. So if you're looking at that picture on the screen right now, you can see there's a grey tube. Where that grey tube connects onto the left side of the machine, you actually pull that off, and there's a little metal connection, and you unscrew that, and the filter sits inside that. And the filter is designed to catch all of the dead skin debris that you vacuum off your client's face, and it stops it going into the machine. So that filter, you can actually get 2 to 3 treatments out of each filter before you need to change it again, but be aware that that is an ongoing consumable. Now, with your Diamond Microdermabrasion, that's your only consumable. With some of the crystal machines and things like that, and these days some of the hydro machines that use either water or skincare serums, like the wet peeling systems, there's consumables associated with them. You've either got your crystals or you've got your skincare serums and those kinds of things. But with the Diamond system, your only consumable is the filter. Now, you get a little bag of filters to begin with if you purchase the Comfortel machine, and then those are available as an ongoing consumable, but they're not terribly expensive. You get a bag of 100 filters, and I think from memory it's about $33 for that bag of 100 filters. And as I said, you'll get 2 to 3 treatments out of every single filter before you have to change it. So it's actually a very, very low consumable. That's one of the beautiful things about this machine. Now, you will also get a manual with the machine, which will basically talk you through everything that I've talked you through in the webinar today. So you'll basically get all of that information in writing. You can read it over, pass it on to new staff that you may have coming on board to your salon. And there's a lot of that treatment information in the manual. And as well, you will get some protocols for treatment, how to perform the treatment, and also how to clean the tips correctly. All of that information comes with the machine. That comes in the manual. You will also have access to the full training video. So what we've shown you today is in place of us being able to do a live demonstration, because at this point in time we're still not permitted to do that. So we've actually run little sections of our official training videos. So we actually have those videos available in full through our website, and when you purchase equipment from us, you get access to those at any time. So definitely you'll get all of that support as well. So that is the Comfortel machine. So shortly we'll open up to any questions. If you want to ask any questions about the machine, if you want any further information, we'll go through with you how you can actually get some extra information. So depending on where you all are, and I'm hoping that you're coming from far and wide, as I said before, we have showrooms in most of the states. You can see all of our showrooms listed in front of you there on the screen. So depending on where you are, there will be a showroom hopefully not too far away from you. And what you'll probably need to do is get in touch with the manager of the showroom using the phone numbers that are provided for you there. At the moment, because of everything, COVID-19 restrictions and things like that, our staff aren't always in the showroom. We've got a lot of our staff actually working from home at the minute. But if you get in touch, they'll be able to make some arrangements for you or let you know when they are actually going to be in the showroom. And you can make some arrangements to go into the showroom, have a look at the Diamond Microdermabrasion machine, and get a little bit of a live demo. So certainly feel free to contact any of our wonderful sales staff at any of those offices, and you can get some more information and, as I say, have a look at the machine in person. Nothing like trying it yourself. So even if you just give it a little bit of a go on your arm or your hand, and whoever's in the showroom can actually talk you through all of that and give you any extra information that you might require. Now, question time. What I'm going to ask everybody to do, if you have got any questions, if you just pop some text into your text box, you can actually ask some questions. Now, you won't see anybody else asking questions. You don't see anybody else's questions. You will only see your question that you might type in. So don't think like it's not working properly or something like that. I'm just clicking into the chat section now. So I'm just going to go through some of those questions quickly. I'm sure that there will be quite a few people asking the same sorts of questions, so I might just try to kind of cover over some of those. So just bear with me while I go right up to the top. Some of you may have been typing in some questions. Okay, so I've got lots of people asking about the cost of the machine. So our machine, in Australian dollars, I'm not sure if I've got anybody watching here from New Zealand or Singapore. Obviously, the cost will be a little bit different, but in Australian dollars, our machine is $1,495. So just under $1,500. And as I said, what you get with that is the 10 tips. You get the box of 3 hand pieces, and you get half a dozen or so of the little filters to start you off. And that's enough for you to do, sort of 12 to 15 kind of treatments to start you off. As I mentioned, the cost of the filters, you get a bag of 100 for 33 Australian dollars again, and that's your only consumable with the machine. So hopefully that covers any questions about price. Now, I've got a couple of people asking about if we're recording. Now, yes, we are recording. I just want to let everybody know that we are recording the webinar today. That will be available on our website. So if you go to Comfortel's website, which I'm sure that you've all been there already, which is how you've registered. So on our website, you will find a little icon that says Help and Service. It's sort of up on the right-hand side, a little icon that says Help and Service. If you click on that, it will then take you to a little section where you can watch troubleshooting and how-to videos. So it's not available immediately, but in the next day or two, we'll get the recording of today up, and it will actually be available for you to watch back, or maybe, anybody that missed out or something like that. If you've got friends who you think might be interested, you can let them know. So certainly it will be available online in that way. Okay, I've got, yes, lots of people asking about recording. And, somebody very nice saying thank you. That was very informative and they really enjoyed it. Thank you very much. I hope everybody's enjoyed it and got something out of it. Now, I've got somebody asking, can you purchase extra diamond heads? Now, you can, but not individually. So we sell the tips in a box. So if you want extra ones, you purchase a box, and the box is, as we've been looking at throughout the video today, you get 10 in total. So the 5 small ones and the 5 large ones. And I think Australian dollars, again, it's just under $300 for a box of tips. I think it's $297 or something like that. So you can purchase a box. Now, if you've got a big salon or you've got lots of staff, I would highly recommend that you do get a second box of tips, because as I was mentioning, when you do your sterilisation process, you need to make sure that all of the tips that you've used are cleaned and dried before you can reuse them. So as I mentioned as well, I sometimes use 3 or 4 tips just for one client, 2 large ones, and sometimes 1 small one, sometimes 2 small ones. So you need to make sure that you've got plenty of backup. So we very often do recommend, if you're a large clinic and you've got lots of operators and you're going to use your machine a lot, a second set of tips is actually really, really helpful to have. Let me just have a little look and see who else is asking some questions that I haven't answered just yet. Sorry guys, just bear with me. I've got a whole heap of them here, so I just need to kind of go through one at a time. Okay, so I've got somebody asking about replacing the tips. Now, you shouldn't need to replace the tips unless you do something that damages them. Basically, the diamond tips are so fantastic because diamond, as most of you would probably know, is the hardest substance known to man, and the only thing that will actually damage a diamond is another diamond. So the diamond crusting on the tips is actually very, very durable, and it doesn't kind of wear out or anything like that. Having said that, if you soak your tips in bleach, you will corrode them, and then you'll probably need to replace them. If you were to drop your tips on the floor, say if you had a tile floor and you were to drop them very often, it's possible to crack the adhesive that actually sticks the diamond crusting onto the stainless steel tip. I have seen that only once or twice, not very commonly. And if that was to happen, you can get a little, like a chip of the diamond crusting can kind of come away. And we recommend that you check your tips often to make sure that they're in good condition, because if something like that was to happen, it can leave a rough area. You might cut or scratch the client's skin. So check them, make sure that they're in good condition and that that hasn't happened. If that has happened, then you may want to replace the tips. But as a general rule, if you look after your tips, if you clean them properly using the correct solutions, those tips are good for basically for life. I personally have had my machine for almost 13 years it would be, and it's still perfect. The tips are still in perfect condition. So unless you damage them in some way, you shouldn't need to replace them. They're actually good to go. Oh, I've got lots and lots of questions coming in. Bear with me, guys. I'm just trying to skate right back up to the top of my questions list. Okay, I've got somebody asking, would you avoid the beard area on men? Yes, sometimes you have to. If men have got whiskers, and particularly these days where, beards are so super fashionable and just about everybody's got one, you actually can't get through the barrier of a beard or a significant amount of whiskers. So if you've got a bearded client, there's no point doing basically the area that's covered by their beard. So some salons actually do men's facials with a slightly different costing because they're taking into account that they're going to use less product and less time. So that's something to think about if you've got a lot of male clients. If you've got male clients who are clean shaven, as long as they don't have a particularly thick beard growth, as long as they've shaved, the day before or something like that, you can get a good treatment, but as long as there's not too much length on the whiskers, because that will actually prevent you getting a good suction. So yeah, that's something definitely to think. I've got somebody asking about UV. Does the microdermabrasion make the skin more sensitive to UV? Yes, absolutely it does. As I mentioned, it's really important. You have to put some sunscreen on your client before they leave your salon. And I mentioned also how important it is for them to have some sunscreen as a regular home care product. So every day they need to be using some sun protection, because yes, when we take the surface layer of the dead skin off, it does make the skin more vulnerable to the UV. Now, I've actually got somebody asking about the diamond tips. Now, saying that they've actually experienced the tips not working as well. I've actually come across that in the past as well. We've actually had some people asking us, why are the tips going smooth after a couple of uses? I had a particular instance where somebody was saying to me, oh, we've only used the machine a couple of times and the tips have all gone kind of smooth and they're not gritty anymore. And I got those tips sent back to me and I had a look at them, and what was happening there was that there was a bit of a breakdown in the cleaning process. You have to use the toothbrush with the detergent to scrub the dead skin out of the tips. And in this particular instance, that's what I found had happened. The tips had been autoclaved, but they hadn't actually been cleaned and scrubbed first. So basically the roughened surface of the tip was full of dead skin. So it's vitally important that you have got to scrub the surface of the tips with that little brush. And as I said, I use the toothbrush, a nice firm toothbrush. You've got to get all of that dead skin out of the tip. Otherwise, number one, it's not clean. Number two, it will actually make the tip feel like it's not working properly because it's actually full of dead skin already. So just to address that, I actually have seen that once or twice. Somebody else asking, does the tube and the hose need cleaning? Yes, I recommend that you do that. You don't have to do it after every treatment, but do it fairly regularly, like, you know, once a fortnight or something like that. The hose very easily disconnects from the machine, and you basically run some hot water and soap through it. It doesn't need to be sterilised because the vacuum only works from the client's skin back through to the machine. So, you know, nothing from the hose is ever going to come back and get onto the client's skin. So hot water and some soap or detergent, you give the hose a really good run through. You'll be quite horrified to see what comes out of there, to be honest. There's a lot of dead skin debris that comes out. So definitely do wash it. But after you have washed it, you need to make sure that it's completely dry again before you reattach it to the machine. So I recommend that, say you work until 4 o'clock on a Saturday, do the washing of the hose or the tube 3:50 on Saturday, hang it up to dry. So hang it or peg it in a vertical hanging position so that all of the water can kind of run out of it, and it will be 100% dry by the time you come back to your business a couple of days later. So we don't want any water left in there. If you've got water left inside any of your components, the next time you do a treatment, all of the client's dead skin debris is going to kind of turn into paste inside the machine. So definitely make sure that it's all nice and clean and dry. Somebody else asking about warranty. 12 months warranty on the machine, and I think it's 24 on the parts. So I think that's correct. You may want to check with any of the sales stuff, because I'm actually not in sales, I'm in training. Sometimes I'm not 100% sure on all of those, but I think that's correct. It's 12 months on everything and 24 months on parts. That's sort of standard across most of our equipment, I believe. So hopefully that answers that question. Now, somebody else asking me about a wire brush damaging. That's a good question. I don't know. I tend to use the toothbrush because I find definitely that won't damage. Possibly a wire brush. I don't know if you might damage some of the adhesive. You won't damage the diamond because, as I said, the only thing that will damage the diamond is another diamond. But the diamond grit is actually stuck onto the stainless steel tip with an adhesive of some kind. So I would probably just be a bit careful with that. I really do find that the firm or hard toothbrush works very, very well, and definitely you're not going to damage any of the components. So I don't know for sure about the wire brush, but I'd say err on the side of caution and use the toothbrush, because I've been doing that for 10, 12, 13 years and never had any problems with that. So hopefully that answers that question. Now, let me see, is there anything else that I have missed? I've got lots of people saying that they've enjoyed and got a lot of information. Let me have a look and see if there is anything else that I need to address. Sorry guys, I've got a huge list of questions here, just making sure that I'm getting right back to the start. Okay. How comfortable is the microderm for clients? It's actually quite comfortable. They will feel some sensation. They will feel literally like, if you can imagine being the carpet and being vacuumed, that's what it feels like. You'll feel the suction. You'll feel a little bit of abrasiveness of the tip kind of gliding over the skin, but it's not uncomfortable at all. So it's not something like laser, for example, where you have to say to people, oh, you know, you're going to feel this little bit of discomfort or a little bit of a sensation. It's actually very comfortable. I've never really had anybody say that it was painful or anything like that. If you overdo it, if you use an abrasive tip or too strong a setting, or if you go over the same area again and again and again, it's possible to damage the skin, which will be a little bit uncomfortable afterwards. But in terms of the actual treatment, very comfortable. As I mentioned earlier, don't go over areas of inflamed acne. Like if somebody's got a couple of pustules or an area of inflamed acne, don't go over that. That would be uncomfortable, but it's also a risk in terms of blood and pus exposure, as well as if you break open those blemishes, they're going to end up with a scab, which may leave a mark. So that would be about the only thing that I'd say might be a little bit uncomfortable for people. But as I mentioned, we don't recommend that you do that. So if you do your treatment correctly, you shouldn't have any discomfort. It's actually very comfortable for most people. Okay, now I've got an interesting question here about SPF protection. Somebody's saying that the sunscreen doesn't stick to the skin without the stratum corneum. So the question is, how would we use the SPF when it won't actually stick to the skin? Or does the microdermabrasion not fully remove the stratum corneum? Correct. It doesn't remove all of the stratum corneum. It reduces the stratum corneum. So probably up to about 1/3 of the stratum corneum is the estimate of what we take off. So we don't take off the whole thing, absolutely not. So there will still be some stratum corneum there, and your sunscreen will kind of adhere to that. So it really only removes that extreme outer layer, and as I said, maybe about 1/3 of it. So hopefully that answers your question, Fiona. That was. Okay, lots of people asking again, can I watch this again? Yes, as I mentioned, it's going to be on our website. Give a couple of days for our tech manager to kind of get the video up for you to be able to watch. Now, I've got somebody asking dermaplaning and microdermabrasion as a treatment together. So now I don't do dermaplaning, but I do know a little bit about it. It's basically like a less intensive version of the microdermabrasion. Perhaps it doesn't have the vacuum associated with it, and the dermaplaning tends to remove the fine vellus hair from the skin, which the microdermabrasion does not. So they are a little bit different in that way. So the dermaplaning doesn't give you the vacuum. So you could probably do the two together. What I would probably do would be to do maybe the dermaplaning first and then the microdermabrasion after that. You might want to use a slightly less abrasive tip, and you might want to use a slightly lower vacuum setting if you've already removed some of that stratum corneum. But certainly you could do the two together because they will give you slightly different benefits. The microdermabrasion definitely does not remove that vellus hair from the face, so you won't get that result. But also the dermaplaning doesn't give you the vacuum suction. And with regard to that vacuum suction, that's really beneficial for the microdermabrasion because that's where we actually get our dermal benefits from. So that vacuum actually stimulates the dermis by bringing up the blood to the skin, and that's where we get some of our longer term results in terms of collagen rejuvenation and that kind of thing. So certainly if you're using your dermaplaning, you may not get that, but you will get that with the microdermabrasion. So yeah, I would think you probably could. Now, somebody asking, can you use local anaesthetic? You don't need to. It's not uncomfortable. It's not like laser or IPL where you're getting that flash of heat and that zapping or that snapping sensation. It's not uncomfortable at all. I've never used a local anaesthetic, and I've never had anybody find it, so painful that, they felt the need for anything like that. So yeah, not necessary at all. Somebody asking questions about how long should we wait for injections. Now, that's a good question. I normally say if you've got a client who's had injectables, you do not want to do a microdermabrasion or pretty much anything for at least 2 weeks afterwards. If they've had injections, say last week, say you were to come along this week and do a microdermabrasion, there's definitely a chance that you could actually be moving their filler or their anti-wrinkle product or something like that, which is definitely not something that we want to do. So the rule is a minimum of 2 weeks. You might even want to leave it 3 weeks. However, if you've had a microdermabrasion, say today, you could go and have your injectables a few days later. That wouldn't be a problem. So the main risk here is that we do not want to do the microderm after and risk moving any of that product. Hope that makes sense for everybody. Lots of people asking about other webinars. Yes, we will have some more coming. We're working on some at the moment. We'll have one coming for oxygen facials using our OxyOasis facial system. We will have some tutorials on acne. So some of it is kind of relevant to our products and our machines that we sell. Some of it's just education. So yes, we will have some coming. They take a little bit of work to put together, so bear with us, but keep checking in with our website. And I'm assuming most of you guys have come to our webinar today through our direct mailing system. So definitely keep your eye out for what's coming. Now, somebody else asking about laser. So I would definitely avoid treating somebody within, depending on what kind of laser they've had, but I would say minimum of 10 days, perhaps 2 weeks to be sure. So 2 weeks before and 2 weeks after. So make sure that you separate out things like laser and IPL by about 2 weeks if you can. If you're doing the treatments and you know what people are having and what kind of treatments they are, you may be able to work a little bit closer than that. Just make sure that you're checking your treatment protocols for that kind of thing. But if you've got clients that have had treatments elsewhere, be a little bit cautious, and particularly if they've had more invasive things. So just be careful if they've had other things like laser resurfacing, for example. Definitely don't want to do any microderm over that. Any other questions? Let me have a quick look before we finish off. We're just about done. Okay. I think I've just about answered most of the things that I can see. Just have a quick check before we finish. Okay, got somebody asking the difference between diamond and crystal. Basically, the crystal machine uses vacuum suction, but it's like sandblasting the skin. So you have these very, very fine crystals that are sandblasted onto the skin and then vacuumed off. So you've basically just got a different kind of abrasive material. So whether you use the crystals to sandblast or whether you use the diamond tips for the vacuuming, they both do similar things, just a little bit differently. The crystal machine uses a little bit more in terms of your consumables, so your cost is a little bit higher, and it produces a slightly more intensive treatment. Now that can sometimes be a little bit uncomfortable, a little bit more uncomfortable than the diamond treatment. So there's a few differences between the machines and the way that they work, but basically doing the same kind of treatment and getting sort of similar results. So hopefully that answers that question. Excellent. All right, I think we have just got to the end. I think I've kind of gone through most of the machines. Somebody asking about the second pass. We try to go the opposite way. If you've done your first pass vertically, do your second pass horizontally if you can. There'll be some of the areas of the face where it's not really possible to do that because you won't get a good suction. So it doesn't really matter. It's not the end of the world, but I often do recommend do one vertical, one horizontal, or do two diagonal in different directions just to make sure that you've given a really even coverage of the skin. Okay, now I've actually got somebody making a note here saying that some people were saying that they've got trouble accessing. At the last minute today, we were actually told that we'd gone way over our maximum list of attendees. We actually had about 300 people who registered for today. So thank you so much for your interest. I believe that some of you may have had trouble getting on because we were numbers limited. So definitely we will have the recordings available. So definitely go to our website and have a look in the next couple of days and you'll be able to watch all of that. Now, medications and contraindications, yes, definitely. So all of the standard sort of precautions like Roaccutane, recent peels, laser, those kinds of things. Pregnancy and breastfeeding, not really a major issue. Just be aware that when you're pregnant, you tend to be a little bit more vascular and a little bit more sensitive. So you might want to take it a little bit easier, not use as intense a setting with your vacuum, and your diamond grit might be a slightly finer one. So you can certainly do the treatment, just be aware of the skin sensitivity and the vascular activity of the skin. Okay. I think that is probably the majority of the questions, and I feel like I'm going way, way over time, so I don't want to take up any more of anybody's time. If there's other questions there, certainly feel free to, contact all of our staff at the relevant locations, wherever you happen to be, and you can get some more answers that way. Definitely feel free to get in touch with our staff at any of the locations. Hopefully that answers most of your questions today, and I hope that you've all got something interesting and beneficial out of today. And as I said, in the next few days, go to our website, have a look, watch it over again, and hopefully you might even pick up something extra the second time around. So in the meantime, guys, I just want to say thank you very much for your time and your effort and your participation and all of your truly excellent questions, and keep an eye out for our next series of webinars, which, as I say, you'll be advised. So keep an eye out for those. Thanks very much, everybody. Bye-bye for now.